I'm gonna wash my hands with hand sanitizing gel. And in this video, in this video, I'll be doing an assessment on my patient. And first, I'm gonna wash my hands. I'm gonna apply my gloves. I'm going to wipe my stethoscope, and then I'm gonna identify if I have the right patient. Hello, good morning. Could you identify your name and date of birth, please?
Um, Sarah Lee Brown. I was born on the 25th of July, 1950.
Thank you. My reason for being here is to do an assessment on you. May I have your consent, please?
Yeah.
Thank you. First, before I start, I'll be ensuring I provide privacy. I'm going to start with the ears where I check for there's no ears is there's color of his ears is normal and symmetrical. Second, I'm going to move into where I check her oracle and her sugar. There's no tenderness to it. Then I'm going to move in here where I whisper. Can you repeat back to me?
How old am I? What is my name? What date is it?
Good, and she heard bilaterally. Now I am going to inspect her nose and sinuses. Nose is midline, breathe from one, and there is no discharge and no potency of nasal passage. And now I'll be assessing her in frontal. Are you experiencing any pain?
No.
No. There's no tenderness to it. Now I'll be moving in here where I assess her mouth with a tongue depressant. Can you open your mouth? Gum, there's no swelling. Her lips, rather. Her lips is hydrated. There's no skin. The lips color is normal, and her gum, there's no swelling or bleeding, and her tongue is midline. There's no broken tooth, and her tongue also can be able to move from side to side, and there's no lesion of the tongue or discoloration. Now I'll be assessing her for her cranial nerve number 9. When I say when she say her vulva arise, softly arise normally. And now I'll be assessing her cranial nerve number 12, in which where she's able to pass. Now I'll be assessing her neck. There's no tenderness. Skin color is normal, and there's no scars. There is no lesion, and also when there's no masses observed visible, and there's a visible sign of enlargement of the thyroid. And are you experiencing tenderness?
No.
I'll be now assessing the carotid arteries. There's no tenderness?
No.
Top to bottom to top, or side to side?
No.
Any pain?
No.
Thank you. Now I'll be assessing her for cranial nerve number 11, which can you move your head to the left or to the right? Thank you. Seems to be symmetrical, and position is normal. Can you also shrug your shoulder against resistance? Thank you. Now we're moving in here where I do the skin integumentary and muscular skeleton. Can you there's no lesion, no scars, no discoloration of the skin. Skin color is normal, and there is no temperature. Now assessing where I continue to assess the skin, the integument of the skin. There is no tenderness also, and there's no lesions as well. And now I'll be assessing her where I assess range of motion. Can you do flexion and extension of the elbow? Flexion, extension, Perfect range of motion with the elbow. Can you do it also with your wrist? Where you do flexion and extension? One more time, flexion, extension. Yes. Normal. Can you also do extension and flexion with your fingers? Good. Perfect. And can you do pronation and supination? Mm-hmm. Perfect. And now we'll be doing where you um do abduction and adduction, your abduction away from your arm. Are you experiencing any pain,
No,
any tenderness?
no.
There's no swelling or anything. No, I'll be moving it here in which we assess our thorax, and I'll be using my stethoscope. Um, can you turn to me this way? Turn to me this way. Okay. Where I cameras cannot use my hand this way to see if there's any scars, any swelling, any tenderness, any bruises to the and not bruises, any tenderness, any lesions, any skin discoloration or so on. Everything seems to be normal and functioning well. Now I'll be assessing her before I do that, I'll be accessing her APT ratio, and before I do so, I will ensure the anterior part of the thorax also there is no form of tenderness. Feel any pain?
No, I do not.
Okay, but after that, I'll be assessing her APT ratio and 99. Everything seems to be 99. 99 at the front as well, so it's 99. And also, I'll be checking her for breathing. Can you breathe in? Out? In? Out? In? Out? In? Out? Out? Perfect. And her when assessing her breathing, her lungs is clear. So respiratory is clear. There's no signs of any crackle or wheezing. And before I had skipped one part about the nail. Then there's no contour. The capillary refill is normal, and that was supposed to be at the front. And now there is no scars, I said before, of the skin, and there is no lesions, and there's not also no the rhythm of the rhythm is normal, and that's it. Thank you. Thank you for having me.